there's been a big petition. I think 400,000 people signed it about hospital parking charges in England.
Yeah, those parking charges scrapped for NHS staff and volunteers during the coronavirus pandemic. After that petition, we can get some reaction now, I think.
Yes, Mike Adams from the Royal College of Nursing is in Birmingham for us. Hey, this is good news, isn't it, Mike Adams? Good morning.
Good morning. Yeah, this is definitely good news. At a time when nurses and other healthcare workers are working tirelessly to fight this pandemic, we're really pleased the government's listened to what ourselves and other organisations have been calling for and have these car park charges suspended.
And from the Royal College of Nursing, I mean, you've got lots of members. What have they been telling you at the moment? It's always good to kind of get a feel from someone like you who's in contact with lots of these nurses.
Yeah, I mean, most of the things we're dealing with at the moment is still around kind of uncertainty around the protection equipment, uncertainty around where people might be redeployed to. There's no question that nurses are absolutely committed to wanting to do their bit and, you know, going straight into this without question of the risks themselves. But there's no doubt there is anxiety out there is uncertainty, and we do think that it needs to be more done to get information to our nurses on the front line in terms of reassurance around the equipment that they're getting in a timely manner, and that the equipment that they're getting for roles such as community nurses, mental health nurses who are going into people's homes that actually haven't got that equipment yet because they don't quite meet the guidance of when it's required.
Mike, anecdotally, stories are coming through, be it via social media, be it just through word of mouth from many people. And I want to ask you something about the guidance that healthcare workers have been given and the feedback you're getting from nurses who are on the front line. There was some national guidance given to nurses on the 14th of March, which said that if staff have had contact with a positive case of coronavirus, brackets, even if full PPE not worn, protective equipment, they can remain in work unless a staff member becomes symptomatic. Now, for someone being told, you may be exposed, you may not have protective equipment, but even if you are, until you're symptomatic, carry on. Some people may feel that they're almost lambs to the slaughter in this sense.
Yeah, it's definitely a concern, and that is definitely what we're hearing from members, this kind of this uncertainty and this lack of feeling supported in this situation. We've got to make sure that in order to fight this pandemic, in order to keep this as in control as we can, that we need our staff protected. If there's a risk that they've been exposed, we need the guidance to be clear that we are protecting them and isolating them as required.
But the fact is they're being exposed, aren't they? They're being told to work knowing that they will be exposed. I mean, you tell me, I'm not in a hospital, you're the one talking to nurses. They all expect to be exposed to coronavirus, don't they? They all expect or believe they will contract it at some point.
Yeah, I think that's a very real fear, and you know, we absolutely need to make sure that where the guidance is there that people should be wearing the equipment, that equipment is available to them.
And when it's
we absolutely need to make sure that guidance reflects all of the roles across nursing, and that it's not. We don't just focus on hospital care, because the tertiary support nurses are doing is absolutely vital, and there will be a lot of occasions where nurses don't necessarily know they're being exposed as well.
Good to talk to you, Mike. Thanks for giving us some insight on what the nurses are going through.